Hi, I'm Randy Aldridge, and thanks for joining us for Political Pulse. I'm here with John Thompson, our VP of Advocacy, and we're talking about the end of the short session, which is just finished up, and we've got a lot of ground to cover. Thanks for talking with me, John.
Thank you, Randy.
So I want to start with, let's do an overview. When this session began, what were your goals? What did you want to get out of this session?
We wanted to move a prior authorization reform bill that passed the House unanimously last year and move it through the Senate. And our main goal was to educate and socialize that concept to as many members of the Senate that were willing to listen. And we had probably over 75 to 80 conversations with members of the Senate.
And that's a huge number considering how short of a time they were here. I just want our members to know how much we're doing in that building. That's a ton of meetings.
Yes. Our goal was to educate, beat back the misinformation, and socialize it. And what we saw was a lot of head nods. We saw a lot of members of the Senate who have personally experienced prior authorization and were asking us questions that we couldn't answer. So I think this thing got wrapped up in politics and attached to other things that were not necessarily directly related to prior authorization. I didn't hear a lot of no's. I didn't hear any no's, as a matter of fact.
Which is good news.
I heard a lot of we'll see's. Now, of course, the insurance industry is adamantly opposed to this. We were attacked pretty hard with paid media by the health insurance companies defending their position of prior authorization.
But let's talk about that for just a minute, because that was a big thing that we hadn't really seen as much of in prior years. What was that like when that started happening?
It let us know that we were being effective and that we were creating a lot of churn and a lot of questions were being answered. Or, a lot of questions were being asked that maybe those health insurance companies could not answer. So they accused doctors of being the problem. They stated that we didn't take care of our patients. Now, ironically, what we saw today was an article from the Wall Street Journal pop, and in the article basically states that in Medicare, health insurance companies made $50 billion diagnosing patients that didn't have any disease at all. So maybe it's...
Just so everybody knows, today is July 9th, and this is the Wall Street Journal article that came out this morning. That's what we're referring to, and we'll put a link to that with this story.
And maybe it's time that we prior authorize the prior authorizers. It seems that they made a whole lot of money off of sending nurses into Medicare patients' houses, diagnosing them with diseases they didn't have, collected the fees associated with that. And that was before they even started prior authorizing anything. So, rule of thumb is their goal is to make money. The doctor's goal, they swore an oath, is to take care of their patient and to do no harm. And those two things do not sometimes exist in the same room in a friendly manner.
And when the short session ended, prior auth still is hanging out there.
So we have to go back at this again next year unless something pops this year and we can maybe push this along. But we'll be patient. We'll just keep working the way we've been working.
And when you say something might happen this year, they are done with the short session right now. They do come back, I think, monthly.
Yes, sir.
And we just don't know what they're going to do when they come back. And they're all up for re-election. So
yes,
we do have no idea what they'll be tackling.
Yes, sir.
What do you think were some, let's call them victories for us, for the medical society during this session?
I think we were successful in pushing back on some scope changes. We saw 2 attempts in the Senate to redefine the scope associated with MPs and nurse anesthetists. And then we saw a pretty aggressive approach on trying to license naturopaths. And we were successful pushing back on all 3 of those legislative initiatives.
And we also want to talk about the Blue Cross Blue Shield thing very quickly here, because that was a big concern for our members. Just recap what happened with that, because I know that's something we all worked very hard on here in this building.
Blue Cross Blue Shield was going to change their payment policy, which would have impacted our physicians and cost them millions and millions of dollars. And we were successful in pushing back on that and getting them to change their mind and rescind their original rule change.
Right. Originally, they just postponed it, and then within 24 hours, they had, because of the work we did, largely, had rescinded the entire thing.
Yes. Yeah. And I thank them for being receptive to our concerns and seeing it from our perspective.
Yeah, and in the end, we are saving our doctors millions and millions of dollars.
Yes.
That's fantastic. Anything else you want to add that was a victory for this session?
I think we had really good member participation. Our White Coat Day We had 50 members show up. We had over 25 meetings. We had a great legislative reception. Over 60 members and staff attended. Legislative members and staff attended. We had probably 30 or 40 NCMS members attend. All in all, I think we can be proud of this session and use it as a launching pad for us to do even better next year.
And you mentioned White Coat Days. On our website, we've got a link to several interviews from people who participated, because it really was great. Last thing, what happens next? What are we looking forward to next?
More education, more strategic planning, going into the third and fourth quarter, and gearing up for next year in the long session. And of course, we got to see what the election results look like.
That little thing happening in November.
Yeah.
All right. Well, thanks so much, John. I appreciate you clearing all this up for us and talking about it, because it's been a busy time for you, a busy time for our members, and we've been really working hard on behalf of our members. So good stuff. Thank you very much. And thanks for joining us for Political Pulse. We'll see you next time.